So one thing to be prepared for is the number of visits. And many people are a little bit gobsmacked when I tell them the number of treatments. So backing up, the way we decide how many treatments somebody needs depends on the kind of cancer and the situation. So if we're giving radiation to try and cure prostate cancer, we do have to give quite a few treatments. I'll talk about that in a minute. Just by way of contrast, if somebody has a cancer that we don't think we can cure and we're giving treatment to try and relieve symptoms without expecting it to be cured, then the number of treatments is fewer and the overall treatment course is shorter. So for now, I'll confine my remarks to curative external beam radiation therapy. So for most men, our curative treatment programs with external beam radiation therapy are given every day, 5 days a week for up to 8 weeks. And so you can imagine 8 times 5 is 40. It's not quite that. It's between 37 and 39 treatments. And that's a lot of visits to the center. So what you want to be prepared for is, thinking about a time of day that would work for you with your schedule if you're working or have other activities. What you can do is tell us what's best for you, and we'll try and arrange that, for example, so that you're not stuck in rush hour traffic coming to or from treatments. And also being prepared for the number of treatments with respect to transportation. You people are able to drive themselves, but there is a cost to that because the parking is expensive. And, it gets a bit old having to do that both directions every day for that length of time for many people. And so knowing about alternatives to driving yourself is a good idea. Things like the volunteer driver program that we have in Vancouver, the Vancouver area and many jurisdictions have. Oftentimes, family and friends are really happy to do something. Many men will find people phone ringing off the wall saying, "What can I do?" Well, there's something they can do is be one of the drivers, so that's really great. And then there's someone to go have lunch with after, which is kind of good. So that would be the first thing to be prepared for, is the number of treatments and all the logistical things that go with that. The second thing to be prepared for is the possibility of fatigue. So generally it's not too bad, but basically, particularly men who are very, very active, say the guy who's used to working 14-hour days and then going and running for 3 hours, and that makes me tired thinking about that, even not having had radiation. But believe me, I see men like that who are thinking about having external beam radiation. And the way I'll describe that to them is to say, Energizer bunnies do not like their batteries being taken out. So even a little bit of fatigue is quite annoying for them. So, particularly for that kind of individual, and you can spot them a mile away, you really want them to be aware of that and pace themselves, because if people force it, then they feel icky, right? So people who do the 14-hour days and the running through their treatment when they're tired, they don't usually feel very good. At the other end of it, sometimes people with at least a little bit of fatigue will just, all of a sudden lie on the couch and eat chips and watch game shows. That actually makes the fatigue worse. So being prepared for a possibility of some fatigue and more or less how to approach it is not a bad idea. The third thing to be prepared for is all things bladder that relate to the treatment. So there are two aspects of that. Number one is when we recommend external beam radiation, when people come in for treatment, we ask them to have their bladder, quote, comfortably full. Now that's an annoying phrase because men say, what does that mean? So we start off with a standard bit of recommendation, and every center is a little bit different, but our advice is an hour to an hour and a half before treatment, have 3 glasses of water. And then if that doesn't work, then you can fine-tune that. But basically, we don't want their bladder so full that it's about to burst, and that's no good. But you want it to be somewhat full. And, some discussion about that and having an idea how they're going to come at that is important, because, say, if you are driving in from Port Coquitlam in rush hour traffic, you probably don't want to suddenly have a full bladder on the freeway. So timing when they're going to drink their water, their tea, or whatever it is something to think about. The other thing is, not uncommonly, men may have some radiation therapy related bladder irritation. So men may find they're peeing more this is all temporary stuff, peeing more at night and during the day. And cautioning people that can happen and letting them know what they do if it does happen. So what we tell them is talk to us, because we see them once a week as a routine. We can see them more often if needs be, and there are various things we can give them, including a prescription, which will often work very nicely. So we don't want people suffering in silence. The fourth thing is being prepared for the possibility of bowel side effects. So there is a meaningful proportion of men that will find their bowels are a bit different. And there are various strategies we recommend for that. So again, it's a matter of not suffering in silence, letting us know so we can talk about what the best options to manage that might be. And it could include a prescription, or it could include over-the-counter medication that we'd recommend, or possibly dietary changes. None of these things are things we'd recommend as a preventative only if you have bowel symptoms, and you may not, absolutely. The final thing that we want people to know a little bit about is, some of the other things that are done prior to the radiation, so the preparation phase. And so basically understanding what that is, why we do it, and stuff, because that is one additional visit before the treatment even starts, and most people don't fully understand why we're doing that. It's basically a planning CAT scan. And people will often say, well, how is my CAT scan? They're thinking of it like a diagnostic test. I mean, I guess in a sense it could be, but really we're doing it as a planning maneuver. And the rationale behind that, and why there is a lag of, usually between 5 and 10 working days between that planning CAT scan and the start of the first treatment, is helpful to know, just because otherwise people stew at home and wonder, what are they doing at that silly cancer agency and stuff. Just having a sense technically of why that is helpful, then it's less frustrating.